So do you think there is also increasing rate of PCOS and
Yeah.
maybe some challenges in conceiving?
Yeah. So basically, typically, the college going girls which meet us is usually brought by their mothers,
Right.
and that is because of irregular menses.
Yeah.
Or if a couple is married and they are planning a pregnancy for more than 1 year, then and they don't become pregnant, we call this inability to conceive.
Right.
So infertility, we don't label them immediately.
Sure.
If they plan for 1 year with planned intercourse and everything, and they don't become pregnant,
Right.
then we call them primary infertility.
Okay.
So in these patients, we take the history of the girl or the lady, and if she has irregular menses, we ask them to do a sonography.
Okay.
Most of the sonography reports sometimes now show the ovaries having multiple follicles,
Okay.
and the sonologist reports this as a PCOD, which is the full form is polycystic ovarian disease.
Okay.
But we have to understand there is something called polycystic ovarian syndrome, that is PCOS.
Right.
The PCOS incidence has increased, but all ovaries which are enlarged are not necessarily PCOS.
Right.
To label a patient as PCOS, she should have irregular menses, any two of these three criteria. Basically, irregular menses, there are certain signs of hyperandrogenism, means excess androgen, that is a male hormone in the body,
Okay.
like that could be hirsutism, male pattern hair loss, that could be obesity, androgenic type, that is they have a belly,
Right.
or sometimes they have some blackening at the nape of the neck, it is called acanthosis nigricans.
Okay.
So such patients, and if the ovaries are enlarged in size,
Right.
then they are called PCOS.
Okay.
So for such patients, what we essentially do is we first counsel them. We do certain tests, we check their height and weight, and we calculate the body mass index.
Right.
Obesity and PCOS have a direct correlation,
Sure.
and obesity causes PCOS, and PCOS leads to obesity.
Yeah.
It becomes a vicious cycle.
Right.
We do a thyroid hormone test, we do a prolactin test.
Right.
Hypothyroidism and hyperprolactinemia are other main causes. And most of the times the causes we don't know, they just occur.
Okay.
So we explain to the couple about ovulation and how pregnancy normally occurs.
Right.
So essentially all the women have a uterus, which is the womb. They have two fallopian tubes on each side, and there are two ovaries, which is normal. When the girl becomes a lady and starts getting her menses, a group of follicles in either one of the ovaries start growing.
Right.
That is called the ovarian cycle. The follicle grows. One of the follicles becomes a mature follicle, which is capable of forming a baby.
Right.
And say around the 14th or 15th day in a 20 to 30 day cycle, the egg ruptures and the follicle comes in the fallopian tube.
Right.
The fallopian tube is the natural incubator, and this egg remains alive for 2 to 3 days. At that particular time, if the girl has had intimate contact, the husband's or the partner's spermatozoa travel all the way, and then a pregnancy occurs, and then a embryo which is formed later comes to the uterus. Once this egg is released, whatever remains is called a yellow body or corpus luteum. Now all these ovarian cycle changes causes changes in the lining of the womb. So after menses, the lining is shed.
Right.
When the follicle grows, the estrogen, that is the natural feminine hormone, grows. The lining keeps on growing.
Right.
And once the corpus luteum is formed, it also secretes progesterone, which stabilizes the endometrial lining.
Right.
Why this is required is when the embryo comes to the womb, it should get nourishment and blood supply.
Right.
So it gets glycogen and blood supply from this grown endometrium, which is called a secretory endometrium.
Right.
Now suppose the pregnancy does not occur. If the pregnancy does not occur or there is no sexual contact, so the pregnancy will not occur.
Right.
This particular corpus luteum after 14 days just dies. It just shrivels up and becomes atrophic.
Right.
The progesterone and estrogen hormones drop and the entire lining is shed.
Right.
So for the girls who are having menses, we have to explain to them why this occurs.
Right.
And then for the married couple, we have to explain to them how the process of pregnancy occurs and how we approach the treatment.
Right.
Now, for the girls, what we essentially tell them is when the ovulation is not occurring, the second half of the cycle is not occurring, and hence they're not getting periods for a long time. And when they get the periods, they are heavy periods.
Right.
So, as a gynecologist, first we allay their anxiety because the mother is also very anxious. The girl is very scared what is happening.
Right.
She compares with her peers in the college.
Right.
And then we counsel them, tell them that we'll treat the heavy menses part first. We investigate. If there is any specific problem, we address it. We advise them about healthy lifestyle, exercises, healthy diet, at least 10% weight reduction. We cannot give them a very large target and it demotivates them.
Sure.
If there is any problem in the thyroid or prolactin, we correct that part.
Right.
And we tell them that we have to give them an oral contraceptive pill. Nowadays, good pills are available which don't cause increased weight gain.
Yeah.
If the girl is having some hirsute features, we give them an oral pills containing anti-androgens which reduces their hirsutism.
Sure.
Some of these girls we refer to a dermatologist who gives them treatment so that they don't have a reduced body self-image because of hirsutism or obesity.
Right.
And we essentially tell them that they should get menses at least 3 times or 4 times in a year. And this treatment may be prolonged till they get married and till they want a baby.
Right.
The basic treatment for PCOS is giving medicines which will cause ovulation.
Sure.
But we can give this treatment only for a woman for a life of only 1 year. Else it can cause major problems later on in life like cancer ovary.
Okay.
So we reserve this ovulation inducing agents only to married women or women who are desiring pregnancy.
Sure.
For the girls, we treat them with the healthy lifestyle advice and oral contraceptive pills.
Okay. Okay. So, typically, what are the 3 top complaints or requirements for which any patient actually consult
Yeah.
gynac?
So, as I said, different age groups, the majority always is the menstrual complaints in whichever age group.
Sure.
Then in the reproductive age group, as you had pointed out, 50% are pregnant women.
Right.
And 50% or almost 40% want to have pregnancy. So the infertility is rising.
Sure.
And the remaining are gynec problems like the problems of any lump in abdomen or anything coming out per vaginum. So that are the different complaints.
Okay. So, as obstetrics is the topmost requirement for which you are consulted,
Yeah.
do you want to throw more light on that area?
Yeah, so basically as a practicing female specialist, we have a degree called obstetrics and gynecology. Obstetrics deal with midwifery, that is a care of a pregnant woman.
Right.
And gynecology deals with everything except pregnancy.
Right.
Now, motherhood is a dream for every woman.
Sure.
And unfortunately, the woman feels that she is incomplete if she does not become a mother.
Yeah.
So that is why obstetric care is very important. And this obstetric care, we tell the woman to meet us as soon as she becomes pregnant.
Right.
There are certain problems which are in the rise nowadays.
Okay.
That ectopic pregnancy can be there. That is the pregnancy, as I said, it conceives in the fallopian tube. It remains in the fallopian tube due to certain reasons.
Okay.
And then that fallopian tube cannot grow and it ruptures. That can become a medical emergency.
Okay.
If they see a doctor early, we can treat it medically and save the tube.
Okay.
So the part of obstetrics which deals with a pregnant woman is antenatal care.
Okay.
What deals with the process of delivery and labor is the internatal care.
Okay.
And what is after delivery comes the postnatal care.
Okay.
So we had to give a comprehensive care throughout the pregnancy.